Assalamu alaikum. Welcome to this episode of Second Home. Today we cover the Doc Fest 2019 organized by the Indian Doctors Forum. We continue our conversation with some of the doctors here, so stay tuned for some excellent health advice. We are now in conversation with Dr. Syed Mahmood Rahman from the Farwania Hospital. Welcome to our show.
Thank you. Thank you so much.
I would love to know and get your expertise on the diabetic situation of the country here. Tell us, how do we prevent diabetes, and people who already have it, how do we take care?
Yeah, actually, I have to tell you that diabetes is now the major menace in the world. Millions of people are suffering from diabetes. And the major cause of blindness in the world, number one cause is diabetes. So it's a menace, yani. And I think the major cause of this is the lifestyle. People are becoming more and more, confined to their places without physical exercise, and they are very indiscriminate in their dieting and food. Food habits have completely changed. People go for fast foods, and so I think these things contribute a lot to the development of type 2 diabetes.
Doctor, you mentioned something about fast food. Now, diabetes is generally associated with sugar. So, are you saying even if you don't eat sugar but you are eating fast food, then that could also cause diabetes?
Sure, sure. If you have sedentary habits and add to it the diets, these diets are all very rich in fat, and they are all very rich in carbohydrate. So if you take these, especially drinks, soft drinks, and these things, they all contain huge amount of sugars, and people take a lot of chocolates and everything sweet, and they are not going in as usually in previous generations. People used to walk a lot. People used to do exercise a lot. This is becoming lesser and lesser because of the modern amenities and the mobiles, and this made human beings stick to their offices, stick to the children are also not playing more as usual as they used to do it before. I think this is one of the major cause of this epidemic of diabetes, and it's a very, very, very sad state of affairs. Yes.
And doctor, this mindset that because my parents had diabetic, I am going to eventually suffer from diabetes. So why don't I eat as much sugar as I can while I'm young? Because आगे जाके तो होना ही है. Is that a right mindset?
No, it's not like that. Of course, there is a family predilection for type 2 diabetes. It may happen if your parents are diabetic, you are more likely. But if you are cautious, there is a very important, simple test. I always tell people, that it is called glycated hemoglobin. And it's a very simple test, HbA1c we call it. That you have to keep checking, and you can keep yourself control. Weight should be under control. If you should be, the BMI is a very simple test. In every mobile, this app is there to check your BMI. it should always remain between less than 25. That's very important. And to you have to maintain it to by doing exercise and controlling your diet. These two factors play a very important role.
Now, we all know prevention is better than cure, so we have to try and make sure we don't get into that diabetic situation. But let's say somebody is already in that situation, in fact, has had to amputate a part of their body. Now, can that be helped? How can that situation be helped so that it doesn't get worse?
There is very nowadays we have many drugs have come into the market, and sugar can easily be controlled. At least we can stop the progress of the disease. It's a irreversible disease. As the years pass by of diabetes, the pancreatic function decline. The pancreas, which secretes the hormone insulin, which controls the sugar and our all the metabolic activities of our body, that thing cannot be stopped. Once you become a diabetic, the progression of disease keeps on going, but at least you can retard it by proper management. Management is so important, and it's very easy nowadays. And we have armamentarium of so many new drugs are coming, and there are drugs which, especially the people now are becoming more and more overweight and obese. We have very good drugs. They are called GLP agonists. Liraglutide, it's called Victoza, and there is many other drugs which are coming to the market. They are non-insulin injectable forms, and they are not needed every day. Once in 2 weeks, if you give this injection, it keeps not only controls your sugar, but it also controls your weight, which is a very major factor. So newer medicines have come to the market, and they are being coming up, and I think once if you keep your sugar under control and your HbA1c under control, for normal people we are telling it should not exceed more than 6.5. This is the limit. Above 6.5 you are diabetic. But between 5.7 to 6.5 is called pre-diabetic state. In this state, if you are careful, you may revert back to normal. This is the thing. We have to catch people who are obese and who don't do exercise to be in that stage of pre-diabetes, and we catch them and we advise them about their lifestyle, about their diet, about their habits, sedentary habits. If they control this, they may not become diabetic. Once you become a diabetic, there is a lot of very good treatments are there. We have great advancement in insulin therapy. The field is so huge. We have to advise these people to take care of their nails, to take care of their eyes. Every year a diabetic patient is supposed to see an ophthalmologist, because the eyes and the kidneys, these are the mirrors of diabetic complications. Once you see microalbumin in urine, you are worried that it may be affecting his eyes also. Eyesight, major cause of eyesight loss of vision is diabetes. So if you follow up your doctor properly and you have good rapport with your doctor, I think there should be no problem.
Doctor, I'd like to touch upon another fatal problem is high blood pressure. Could you give us some tips on how to handle that?
Now there is a lot of new talk about hypertension. So it's also a major menace, and it is called silent killer, because many people have high blood pressure and they don't have any symptoms, and suddenly they come to us in the hospital with a stroke or with a hemorrhage in the brain, or they come with a heart attack. So these are all consequences of high blood pressure. Nowadays it's becoming more easier. We are telling that the blood pressure, because sometimes when the patient visits a clinic or a doctor, he gets anxious, so blood pressure falsely goes high. It's called white coal hypertension. To avoid this, the international community, the recommendations of the International Society of Hypertension is to always advise people to have their home monitoring system by themselves. They can have their electronic machines, which they apply in the home and measure their blood pressure
Doctor, my
readings.
question is blood pressure high. Why does it go high? Is it high for people who are angry all the time?
Actually there are many, and 90% of the cause of hypertension is called idiopathic. We don't know the cause. Only maybe 5 to 10%, even 5%, we can say that we can try to find out the cause and treat the cause, then the patient becomes normal. It's called secondary hypertension. But mainly it is idiopathic. Idiopathic means without any cause. We don't know the cause of high blood pressure. So one has to keep checking. checking by, you can check by these electronic machines. And also there is a very simple way. If you go to hospital clinics, we are giving patients, to call it ambulatory blood pressure checkup. This machine check, it's a computerized machine, is applied to the patient, and then he goes home with it, and the computer checks every half an hour his blood pressure. Once the blood pressure, this computer, we see it and we make a graph and we see, uh, even this method, a patient cannot visit a patient in the night, 2 o'clock, 3 o'clock, 4 o'clock, or even the daytime when he's sleeping, walking, under exertion, anytime. This machine keeps recording. So this is a very novel way of checking the blood pressure. And once we see the graph, we come to know whether he is going to be hypertensive or not. These are the methods how to diagnose high blood pressure. These are the recommended nowadays, and we have very good medicines for high blood pressure. The first thing, as we say, is DASH diet. DASH diet. DASH diet means Mediterranean diet, rich in fruits, fresh vegetables, green leafy vegetables, olives. You know, if you keep yourself healthy, diet, which is rich in potassium. The,
That's a great tip, doctor. I love that tip. Fruits in your diet is very important. Make sure you eat a healthy diet. Cut down on some of the oils and the polysaturated oils that we're eating. That was great advice, doctor. Thank you so much for talking to us.
always welcome. Thank you so much.
الكويت دولة ما تنحني له، فيها رجال تحبها. الكويت واحنا معاها كلنا الغلاها، جينا نغني في حبها. الكويت دولة ما تنحني له، فيها رجال تحبها. واحنا معاها كلنا الغلاها، جينا نغني في حبها. هنا أصبح المجد هنا، عاد يشدو بالغنى، صوت وغنى لنا. وكلنا نحتفل بك كلنا، يا غلانا وحبنا، جعلك العمر جهنا. يا كويت، الكويت دولة.
We are now talking to some of the performers who are going to be performing an Assamese dance today. Welcome to our show.
Thank you so much.
So, what is this called?
It's the traditional classical form of Assamese dance. It is called the Hotriya dance, and it's a classical form. It was propounded by Srimanta Shankardev.
What is the dress called?
Actually, it's in two parts. The lower part is called the ghuri, and the upper part is just, it's a modification of the chadar. And what we are wearing here is the traditional Assamese jewelry.
Looking so pretty. I love how different places have. It's a very distinct and unique work on your jewelry too.
Thank you.
And what about how are you connected to IDF?
Uh, as you know, Assam is a part of India, and so we are members here of the Indian Doctors Forum, and we have been fortunate enough, to be part of this family. And I've been watching the IDF programs for many years, and it's really impressive, and it's fortunate that I've been able to take part in this year.
And you are here working as a doctor?
I'm working as a dermatologist here.
No wonder. That's your secret to beautiful skin. Tell us about one tip for beautiful skin.
Just be happy from inside. I think that shows on the outside.
Wow, on the dot. I think that's a great tip. Remember, you have to be happy from inside to be looking beautiful on the outside. What a beautiful tip, doctor. And doctor, you're from Assam, and I believe this might be a good time if there is any message you have for your people back home. I would love for you to give it now.
I'm proud to be representing my state in a very minor way. I know in my own humble way, and I have to thank IDF for giving me this opportunity. Thank you.
So, any message in Assamese?
আহ, মই আজি অসমৰ সত্ৰীয়া নৃত্য পৰিৱেশন কৰিব পাৰি বহুত গৌৰৱ অনুভৱ কৰিছোঁ। আশা কৰোঁ আপোনালোকে চাই পেলাই ভাল পায়।
I understood every word. I know you did too. Thank you so much for talking to us. Thank you. It's now time to talk to Dr. Anil Gupta, who is a pediatric orthopedic surgeon. Welcome to our show.
Thank you.
Doctor, tell us about your profession here in Kuwait. Where do you work?
I work in Al Raji Orthopedic Hospital, which is the one of the very super specialized orthopedic hospital in Kuwait, and I am a pediatric orthopedic surgeon there, a consultant.
And that's like a double specialty because it's not just orthopedic, but then it's specially for children.
Yes, it's a subspecialty of orthopedics where you deal with children, children trauma, children some conditions which are from the birth. Then there are some conditions which children, get during the course of their adulthood. So we deal with all those situations.
And doctor, I wanted to ask you something about this. When you say children with birth defects and stuff, surgery. How far can surgery correct something like that?
Oh yeah, surgery nowadays is very advanced, and of course the pediatric surgery is always a delicate thing. You are handling a small child. In Kuwait, we have some specific issues which are related to this population here, which is more than the overall incidence of like the dislocated hips, which you call dysplasia of the hip, and it's more common than the other parts of the world. So it's a very important thing that there is a very good pediatric team, and we take a lot of care in doing this very delicate surgeries on hips and the other congenital deformities.
Doctor, you're a surgeon, and at a time when you had chosen the medical profession, everybody wanted to be a doctor or, of course, an engineer. So when you did get into the doctor's profession, your parents must have been really happy. You knew you wanted to do this, or your parents pushed you to be a doctor?
I think I always wanted to be a doctor, yeah, and I always wanted to be a surgeon. Yeah.
And a surgeon requires, I believe, extremely stable hands. So, is there like an assessment done whether you can actually be a surgeon because your fingers can't move like literally 1 mm here or there?
Uh, yes, surgeons require two things: uh, have to be very patient, and have to be very, very committed, and must have a very good concentration span. Because sometimes you are doing a long surgery, and fortunately, when you are operating, you don't think of anything else other than the patient. So yeah, these are some of the qualities surgeons should have. Yeah, and most of them have. Yeah.
As a surgeon, is there any tip you'd like to give to our viewers? I've been asking dermatologists and ENT specialists about tips. As a surgeon, what do you think your tip is to your audience today?
Well, surgery is very important aspect of medical care, and in fact, nowadays when the lot of media and a lot of technology has come in, you can deal with medical conditions in telemedicine and other. But in surgical conditions, the surgeon has to do it himself. So I think surgeon is a very important part of the medical care.
Okay, doctor, about your involvement in today's function, I think it's amazing performances tonight coming lined up. What has been your involvement in today's event?
See, this function today is Indian Doctors Forum. This is an organization of Indian doctors in Kuwait, and this is now almost more than 15 years we are running this, and every year we host multiple functions. This is our major function here, which is called Doc Fest, which is a kind of a social and entertainment and cultural meeting. But throughout the year, the organization do many social and academic and medical professional activities, including the camps in various parts. So it's a very good organization. Yeah.
Heard about the camps. And doctor, about your time here in Kuwait, how long have you been in Kuwait?
Oh, that's a very good question. I think it's about, I think, 19 years now.
Oh, 19 years. So needless to ask you if you like Kuwait, I'm sure you do.
Yeah, Kuwait is very good country, and the medical health care, the hospitals are very well equipped, and they are improving every day, and it's a very nice place to work. And I think I don't regret my decision to come back here.
Thank you so much for talking to us. Thank you. Let's now have a conversation with another member of the IDF, Dr. Nafis Sayed. Welcome to our show.
Hi, thank you so much. Thank you so much for having me.
Absolutely, doctor. It's always a pleasure to talk to you and to learn so much about how to keep your skin glowing. And as you all can see, her skin's glowing today as well. And you need to tell us how you do that. What's your secret?
No, thank you so much. Thank you so much. Really, no secrets. When you have two little babies, really, it's really a compliment, and you're really sweet. Thank you so much. But well, as a dermatologist, as I recommend to all my patients, a good sunscreen is the most basic thing that you can do as a young mom when you have no time. But never to step out without a good sunscreen is what I really, really recommend. For as long as you can stop the damage and not let it, progress further. So you're good to go. And of course, and as something I'd really like to mention is that your emotional and your mental health really shows on your face. So be happy internally, and that will really show on your skin, regardless of what you apply on top and whatever procedures you're doing or what cosmetics you're using. Your mental status, the quality of your sleep, the amount of water that you're drinking, everything really shows on your face. So basically be happy and keep glowing.
I love your advice, doctor. You've heard the doctor say you need to be happy, all of you out there. This is doctor's instructions. And now let's find out what keeps the doctor happy. He's standing right beside her. Could you introduce yourself?
Hi, I'm Mushir Khan. I'm Dr. Nafis Fatima Sayyed's husband, and I'm into business. And it was really nice to come over here and see all the doctors performing, mashallah. Like they have done it very professionally, mashallah. Even my kids, they enjoyed it. It's a really wonderful, colorful event, mashallah, mashallah.
Which was your favorite, the highlight of the evening?
I just like the ending thing right now, when everyone, like all the different regions of the people, they were singing their regional songs and everything. It was amazing to see that, and it's so lovely too because we are all in Kuwait, so it's amazing to see and refresh all the people from all other states to see everyone together, mashallah. And particularly this was done by doctors. That's mind blowing, mashallah. Very nice.
Unique things going on tonight. It was a spectacular show. Thank you so much for talking to us, both of you.
Having us, Amina.
My kids.
This is all the time we had for today. I'm sure you enjoyed our cultural program today. The health tip you got from the doctors is important. Until next week, when we bring something brand new, from the team of Kuwait TV2, stay blessed.